Good afternoon, everybody, and welcome to today's event, the Business Continuity Institute. This is going to be session 3, Ensuring a Human Resource Strategy. My name is Elizabeth Breidenbach. I'm a meeting and event specialist based in the Clinical Affairs Division here at NAC, and I'm pleased to bring you this event along with my colleague, Jervine Williams. Before we get started, I would like to review a few housekeeping announcements. You have joined this online event by either physically calling in or using computer audio. All attendee lines have been muted and will be muted for the duration of this event. The duration of this live event is approximately 90 minutes, including introductions, presentations, and Q&A. Again, the duration of this live event is approximately 90 minutes, including introductions, presentations, and Q&A. Thank you so much for the folks that have submitted questions in advance. We truly do appreciate it. But like as always, the chat box is available right this second, located in the lower right-hand side of your computer screen. Simply type your comments, questions, or concerns into this box at any time. We will make an attempt during our live Q&A session at the end of today's session. So again, we do have some fantastic content for you, but we do have a live Q&A. So feel free to pop those questions into the chat box at any time. If for some odd reason we cannot answer your question at the time allotted or we need additional resources, we'll make an attempt after the event is completed. Friendly reminders that today's event is being recorded and will be available for playback. Again, event 1 and 2 were recorded and available now. Attendee lines have been muted and will be muted for the duration of this event. Again, the chat box is open right this second, located in the lower right-hand side of your computer screen. You may need to click to expand it to open. Feel free to type your comments, questions, or concerns into this box. If we cannot answer questions in the time allotted, again, we will make an attempt after the event is completed, or we might put it into our FAQ document. And then last but not least, after the event is completed, you'll be presented with a brief survey. This lets us know how we did, how valuable this event was to you, and directly informs us of future training and technical assistance. At this time, I'm going to turn things over to Jervine, who's going to be introducing today's speaker and setting the stage for you. Jervine, the session's yours.
Thanks so much, Liz, and welcome back, everyone. A couple of things before we get into the content. If you attend all 3 of the business continuity webinars, you will receive a certificate of completion. That's just still an added bonus. And then also, we modified the business continuity toolkit booklet, and now the forms are editable, so you can go through and it can easily modify those forms for your health center's policies and procedures. And then the last thing before I introduce our speakers, part 2 of this project, we're going to build a self-guided business continuity plan on our learning management platform, and that will be coming in the next year, so look out for that. And with that, I will turn it over to our speaker today, Nora O'Brien, who is the CEO of Connect Consulting, and her colleague, Amanda Cooper, is going to be a resource in the room as well. Take it away, Nora.
Nora, your line is muted and just need to share your screen.
Great, and sharing now. Sounds good.
It is sharing. Yep, perfect. And
Wonderful.
I see
Great.
it.
Thank you so much. Thank you for joining us. We're really excited. So we have a lot to talk about. Human resources is really crucial to this process for business continuity planning, and so we'll get into the meat of that. Here we go. It shared a second ago. Let's see. There we go. So today we're going to talk about and build in terms of our objectives, the importance of employee wraparound services related to emergency management, disaster management, and more importantly, business continuity. So we're going to build on what you learned in session 1 and 2. And the session 1 was business continuity planning, and session 2 was creating a business continuity plan. We want to provide you with the best human resources strategies and with information and that you want to implement during disruption. And whether it be a small disruption and that only affects your health center, or a widespread global pandemic that affects the entire world. We'll give you some strategies. We also want to talk about the best way, how to support your employees through wraparound services, and cover staff management, incident management during the emergency, and discuss incident response team roles, etc., and review what it means to have successful succession plan. So a little bit of homework for you all right now is, do you have Successor currently for your service? Okay. So we're gonna, as I said, we're gonna talk about diving into talk about wraparound services and how they support your staff during a disaster, but not just during, but also post-disaster, because sometimes the event really depends on how severe it is, but very traumatic to your employees and how to support them. Also, we'll provide you an overview of how to manage staff during disruption and include a review of the standard incident management team, their roles and responsibilities. We'll move into the succession planning and then also talk about telecommuting and state and federal regulations as they pertain to business continuity. Okay, so moving on to wraparound services. So what is wraparound? It might be something different for your patients, but as it pertains to human resources and supporting you in a disaster, it's comprehensive and holistic method of supporting individuals when they experience trauma or crisis. The wraparound places the employee at the center of a support network and also could include close friends and family, medical providers as you as the employer. And why is this important? Well, natural disasters, pandemics, other disruptive events may cause stress and trauma to the employee. And it's also could be a natural disaster, but also might be workplace violence that might affect the individual themselves, or they might be impacted by workplace violence event that happened. Employees may not be able to focus on their jobs and they come to work and they may not have a grasp on the situation. It'll take time to support them and from every employer. So that's important. All right. Here are some strategies for wraparound, again, aims to wrap around that employee to ensure that they have access to the resources that they need. Again, it could be an event that is a worldwide pandemic, or it could be an event that is maybe something that just happens at your health center. Again, like a workplace violence situation, or it could be something that's a community-based event, such as wildfire, tornado, bus crash or something that impacts your, and those are traumatic things. So when it pertains to employment, the wraparound strategy could take multiple forms. It's important to have frequent communication. I think oftentimes what happens in disaster is that you want to share only the information that you think that's necessary, but oftentimes you want to provide that communication through multiple channels. Employees need to know what's going on. They need to know what's next, and even what's next after that of like, okay, we're in this situation. We are going to be temporarily out of our building because of a tornado, and we're going to be back in within the next, within the next 30 days or 10 days or whatever that is. Providing the sense of normalcy may help employees deal with the changes, because if you're not sharing that information and rumor mill happens to go around, what often happens is that they just make up something that's not really supportive of in the workplace. So, freaking communication. Again, avoid making false promises, but ensure your messaging is supportive and hopeful. Like, we really hope to get back on our building in the next 30 days, or we really hope to, we're going to do our best. But using that calm and we're doing our best, and you don't say, okay, we'll absolutely be back in the office on Tuesday or whatever that meant it is. So that calm and that messaging is really key. And use as many communications channels as often, whether it's, do you have an alert system for your organization? Do you have, I know there's Tiger Tail, there's a whole number of alerting systems you can share, so especially many health centers I know have large health center systems where they have, multiple sites across several counties. You may not have time to communicate to every employee what's going on. So that frequent communication is really important. Also check in regularly with employees and encourage them to share with them what's going on. What's also important too, as part of this wraparound strategy, and when you want to communicate to them, really be specific about next steps. After the initial shock of the disruption, employees have to be understanding. They need to know what's next. Do I have a job to go to? Are buildings gone? Are we temporarily moving to a new site? Or are we moving operations to 3 of our other health center sites? Whatever that information is. But your communication should be specific about office hours, in the days and weeks ahead as well. Flexibility on, modified work schedules, how to report time off due to the disaster, how often and what it means, in what manner the employees need to communicate, with their supervisor regarding their availability. For example, it might be a wildfire situation and they've been evacuated. So do they evacuate? Do they come into the office? That again, communication is important. Which part of the building or the office or the clinic site is functioning, what's not. Again, that's communication is really key. The support recovery is important as well. Employees recovering from a disaster or disruption, they need support. Think about many organizations, many health centers that we work with have employee assistance programs. Those are perfect opportunities to use those EAP programs, have people seek assistance in those EAP programs. It might be easier if they want to contact, but most health centers also have behavioral health at some point, and the behavioral health, they might also be a support to the health center staff. But they themselves, as behavioral staff, they also might be dealing with their homes, or they have to evacuate their homes, or whatever the situation may be. So think about relying on your EAP programs during this time as part of your wraparound strategy that you use to support your employees during disaster. And then sometimes you have to address the survivor's guilt. That's something it's a real situation. People are like, how did it happen that I'm here and, the person that sits next to me, in my cubicle is not. Those kinds of lingering situations, when people see suffering on a large scale, they really feel helpless and they feel guilty. Employees, you remind your employees that guilt really doesn't help anyone or the situation. Rather than sit with that guilt, encourage your employees to put their energy and emotions into recovery and helping others. Sometimes, because community health centers are so phenomenal at helping their community, thinking about ways that can you help others? Can you serve as a point of distribution site for handing out personal care supplies or diapers or food or water or whatever that may be? That also sometimes helps with the survivor guilt. And then, as a reminder, they may not be ready to do this, and so depends on the type of disruption. So it's something to put your HR hat on and say, how are people dealing with this? Kind of recognizing what that individual needs. But that's another strategy of addressing that there's survivor guilt, not to sweep it under the rug. We all know that mental health, is something that's not to be taken lightly. So thinking about ways that you can support your employees. Okay, moving on. Wraparound outcomes. So evidence shows that individuals experiencing trauma and crisis recovery, they do better when wraparound services are well executed. Something that we know about health centers, given that I've worked with health centers in one capacity or another since 2001. I was at the California PCA for a number of years, and then we work with many health center clients as Connect Consulting for the last 12 years. We understand that you guys are really good at serving your community, but also you need to take those services inward and support your employees. So we're not saying that you don't have these things well, but it's something that's should be part of your resource toolkit, is figuring out how you can support the trauma and crisis of your staff during disaster and providing those wraparound services. So people also who participate in wraparound programs tend to have a more positive outcome. You know, again, we're trying to get to recovery, and recovery is not just, you know, putting the new roof on the building after it's been damaged, but it's also building that internal resiliency for those individuals. So, you know, some of the outcomes, when you have a good wraparound service program for your employees, you get better engagement with their job and with their staff, enhanced empowerment, like, oh, I can do this. This is, you know, this is something that people feel a sense of accomplishment, improve coping and problem solving because they know that they have the support of their supervisors and their fellow employees. They also can function better on the job because this is not just, oh, we want you to do your job better. This wraparound service, think about in terms of disruption is important, of how they can do their job better, because everything you do as a health center is all about process improvement. Same thing with looking at developing a wraparound program. So I'm interested to know when we get to the questions, if folks have wraparound programs or what they look like, or if you have something that's may not even call it wraparound, but whatever you can do, would be really interested to hear what your stories and have you share with us. That would be great to hear. And then what's important too, lastly, is once you have a program that's well executed, your employees are more engaged, they're back to work, they have a positive outcome, they really get in that improve their quality of life and their resilience. Like, oh, okay, well, this was, this got us down, but we came back, and this is how we get to recovery. So those wraparound outcomes are really important. Now we're going to share with you a health center that this is the Bart Altadena Community Health Center in California. And they're going to share with you their vaccine clinics and what the process they did. I am going to go ahead and hit play and kind of share with you all. Here we go. So this is Bart Altadena Community Health Center. They're in Lancaster, Palmdale. So on March 17th, so we're going back a little bit of information, yeah. So their first allocation in December is what they received. So this is some of the information, and this is what they've developed. Okay, so this is in Lancaster. On March 17th, 2020, at the start of the pandemic, shut down our communities. Bart's leadership team met, planned, and successfully pivoted clinical operations to include both internal and external screening protocols at each of our 3 sites. Included in these protocols at our busiest site in Lancaster was the complete closing of the main entrance and a conversion of an open suite with a hand washing station, a place to record temperatures, and a pop-up indoor examination room using tents for further screening and isolation. At the Palmdale and California city locations, we utilized our mobile clinics for examination isolation units. They worked with their community partner, the Children's Center for Antelope Valley, to bring additional staff and security guards to manage the lines and the crowds. A clinical provider of the day, so to speak, was assigned with support staff to handle appointment confirmations and information collection from patients. They identified the need for additional screening and security, traffic control, and ultimately began recruiting for the new position of security protocol. It required greater responsibility on the COVID-19 response team. The critical component of the response team and Bart's efforts was to component of the team and Bart's efforts to prevent the spread of COVID-19 was their implementation of internal staff screening protocols. Each member was assigned to check and record temperatures upon daily arrival. Employees received intensive training regarding social distancing and workspace that was designed to allow employees to work with masks at a distance of 6 feet as normal. Telehealth allowed for providers to limit clinic time and time in the clinic, and departments rotated their staff for off-site work. Bart's tested employees regularly, and each of the prevention at the COVID-19 lead oversaw all aspects of COVID-19 response throughout BARTS and shared a weekly recap of all, including the agency, city, and county updates. They also provided updates at education at the monthly provider and leadership team meetings. When transitioning from screening and testing to vaccination, BARTS reached out to the cities we operate in and offered our partnership and medical assistance to coordinate with mass vaccination distribution efforts. In addition, we pooled our resources with our medical partner agencies to maximize the capacity within the workforce. The chief medical officer volunteered his time to manage and oversee Saturday clinics, and with the goal of utilizing only volunteers, which prevented the disruption of the clinics, and by the collaborations with the city of Palmdale and the California City for 2 large drives through the venues. Okay, nearly almost done. We wanted to share weekly drive consistently held at the Lancaster site, and every days held large off-site drive-through events.
Nora?
Yes.
No, your audio is kind of going in and out. Could you make sure you have a clear contact with your mic?
Sure, no problem. I'll put my headset on.
Thank you.
Sure. Sorry about that. Want to make sure we captured everything. Is that better?
Sounds great.
Much better,
Okay.
thank you.
Okay, sorry about that. We just wanted to make sure we captured everything that they did. We wanted to share the exciting news is that the BARTS team held extensive planning meetings with cities and the site leads and held volunteer training sessions of up to 70 volunteers, and debrief sessions with all involved were held, and recommendations for improvement were implemented to improve future events. To date, BARTS has administered 4,000 vaccines, and our success in responding to our community's urgent health needs is our astounding relationship with the community partners, our mission to heal, efficient operations, and our amazing staff who embody our core values of compassion, respect, integrity, accountability, and teamwork. Phenomenal. Very, very exciting. Good job, BARTS. I mean, and I was also excited to see recently that HHS just had mentioned that health centers have throughout the nation have administered 10 million vaccines. That's phenomenal. And that's about business continuity right there. They did the process improvement. They did great communication. They kept people apprised. They changed the process. They pivoted. So that's phenomenal. Okay, moving on. All right. Here we go. Whoops. There we go. Thank you. Now we're talking about the next topic, key employees, roles, and staff management. Okay, so a key employee is an employee with a major decision-making role in the organization. The designation of key employees is not just about titles, but as who is responsible for crucial roles within the organization's operations. Key employees also have key roles during the crisis as it relates to business continuity and recovery decisions. And during an emergency, key employees are identified and referred to in their incident management or incident role and title, which will likely differ from where they are, whatever role they have during their normal, when it's not an emergency. They're referred to by their title, and many key employees may fill a single role. For example, if an emergency response activity was running 24 hours a day, you would need at least two employees to fill every 12-hour shift in the role of incident commander and all the other positions. Okay, key employees. Right. So key employees, like others, may have different roles and responsibilities during and following an incident. This is something that we often recommend for organizations what we often recommend is for you to identify who can serve in those key roles. Have you identified, and you generally want to have 2 to 3 people deep for each of those key roles, and I'll show you, I'll talk about incident management in a little bit. Because you might think, oh, well, Jose's always here and Jose's always going to be here forever and ever, and I don't have to serve as an incident commander because Jose's here, or Mary or Jane or whoever that person is. That think about at your health center, who is your go-to organization for your go-to. So it's important to think, well, that person may not be there, and it could be that for good reason, like their wife's in labor or they're on a sabbatical, or it could be they're impacted by the disaster themselves. So think about having a number of positions that can serve in those roles. And when employees, fill an incident role that's similar to their everyday role, such as someone in accounts payable and receivable, who will continue to monitor the expenses, you kind of really want to have at least some connection to what their current role is, but think what in a disaster, what other role can they serve? One thing that we often do is request and have people think about taking their organizational chart for their organization and taking the incident management team chart and identifying how many different people can serve as incident commander, how many other people can serve as public information officer, so you get 2 to 3 deep. Ideally you want 3 deep. So that when that person's out of the, that understands your emergency response plan, but that person's gone and not available, someone needs to step into that role. So we also recommend too is for you to think about who is good in advance of disaster, so that you're going, okay, who's incident commander today? Just letting them know who could serve in those roles. The other thing that's important to know is when you're thinking about filling those roles of who can serve in disaster, we do not recommend that you have your CEO serve as your incident commander. And there's a number of reasons for that. And for those CEOs who might be on the line going, what? I'm not going to serve in managing the event. Yes, you're going to have a critical role, but often most health center CEOs have board responsibilities, but they also, and the fiduciary responsibilities, but also the natural role of the CEO is outward facing. And so you have those relationships with public health, hospitals, health plans, NAC, your PCA, your HCCN, or whoever that may be. Those folks are going to be crucial to you and part of your disaster. So having someone that's running the operation of your disaster that's not the CEO is ideal, because they can just be running the operation, and health center CEOs and or executive directors can focus on outward facing of what the resources are needed during a disaster. During a crisis or an incident, organizations may implement an incident command structure. We like it because it's scalable and it's flexible. So you don't have to have 50 positions activated. You can have 5, whatever you need for the needs of the disaster. So as it becomes, what's the word? More complex, then you activate more positions and roles. And as it demobilizes, as you don't need as much operation, for example, during COVID, people had fairly large, they had a lot of different roles activated for COVID, and as things moved kind of more into the mitigation strategy rather than the response mode, you may only have had to meet and had an incident command system that was like 5 people instead of 15, just kind of depends. I think that the other kind of difference is in most events like a hurricane, a tornado, and even an active shooter event, et cetera, when you activate your incident management team and your incident command team, you generally are kind of working in those roles maybe for, or a wildfire, maybe a month or so. And Maybe it's a situation where, like you put out the fire, you start rebuilding the building, you know, figure out and work with law enforcement on active shooter, you work on PTSD for the staff or whatever the thing is. So the recovery mode, you're going to go into recovery pretty quickly. I think the tough thing about COVID has been is that you are both in response mode because the surge of, and the variants of the, and then you're also in mitigation, the variants of the different strains, the mutated strains, and then you also have been in mitigation mode to try to reduce the spread as best you can, in the workplace. So, so you've been activated for so long. We've seen many of my emergency management colleagues go, "Yep, I've been activated for 369 days, and I'm really tired." And so that's just kind of a tough thing. So it's just, that's not the norm. Generally, when you're activated, you're activated for maybe a few weeks or a month in order to help you get back to resuming and the disaster. Okay. All right. So moving into key roles and responsibilities. So about incident command, what a lot of people look at this and go, okay, that this might work for me, but maybe I only need a few positions. Again, you're only activating the positions that you need, that you need to run the disaster and manage that event, that response, and move into recovery for continuity. What's important to know too when you do a business continuity plan, so oftentimes in your business continuity plan, you might have an incident command structure that will be a team just focusing on response. In your business continuity plan, you might have a similar team with similar individuals or similar type roles in managing the recovery. The roles might be different, the positions might be different, the focuses might be different. For example, managing that response, you're going to have an incident commander, but on your business continuity, you might be focused on someone just, let's say you have to get a new building. You might have a recovery team that just focuses on finding a new location or shipping operations to one of your health center sites or setting up your health center, health center, uh, what's that called? Like you have a mobile van, so whatever it may be. So think about this. The other thing that's confusing for some health center organizations is they're like, maybe a really small rural health center and I only have 20 employees, and this is a lot of people, that maybe I'm only going to use incident commander and operations chief and maybe an operations section and maybe a planning section. Fine. This is not, you have to fill in all the boxes. And what you should also know too about incident management is that it's roles, not individuals. So you can have, the only position you have to activate is incident commander. So you activate that one position as it becomes more complex. If you have more recovery things, if you have more, there's a lot more going on, a lot more operations, then you expand to positions. But these are positions, not roles. So what you could have is 3 people serving as your public information officer, your safety officer, and your liaison officer. That can be all one. That could be one person. So that's the other thing to keep in mind with incident management, start with ICS. So the primary role of incident command is to manage and create a structure and management functions that work in a coordinated and systematic approach. You want to be efficient with that. Incidents are identified by the number and based on the types of an incident. A scale, from type 1 incident would be like catastrophic Hurricane Katrina. Type 5 incident might be a small event that maybe just affects your street, whatever it may be. And you can activate your incident management system. You can actually use this in a planned event. Let's say you're moving your building. You're moving from one health center site to another. You can activate these positions to make sure things go smoothly. And structure as you would for different types of events. So if it's a type 5, it's a small event, again, you're only going to activate a few positions. One, you're going to, all hands on deck, as we say. So our incident commander is responsible for the overall management of the incident. They establish the strategy and tactics that's necessary. The ultimate responsibility for the success of the operation. No, no stress. And it's filled at every, the incident command role is the only one that's ever filled. And obviously, again, how small and large depends on how large the organization is. You have then your public information officer. Your public information officer is the person that is responsible for developing the release of information. Think in your organization who can serve. We like for incident commander, do you have an operations chief or a COO, or do you even have maybe your chief medical officer that can serve as your incident command? Think about that. Your public information officer, that person might be someone that takes the notes at your board meeting. It could be the person that knows the information, has great relationships. It could be your nurse manager, but whoever is good at gathering information, doing monitoring of media, doing monitoring of messaging, working with your local public health, hospital, maybe skilled nursing, maybe do you have a with your county emergency operations center. So that public information officer role is key. And again, that's part messaging. So you need to also, that public information officer role is they develop your internal messaging. Let's say you're having an event. An event might be at your health center. You have a workplace violent event that goes horribly wrong. People are injured or killed. You need to develop some kind of messaging about what was done, who, not share public information of, we know this individual is the person that's at large, or that person's at fault, that sort of thing. That public information officer role is key. The safety officer is crucial as well in managing an event, because your safety officer is the person that not just looks at the support of, the overall, making sure if the building's damaged, you don't go back into the building because it may, there's been some kind of event and people might individually hurt themselves. The safety officer will be coordinating with the finance administration section and coordinating, let's say, damage assessment and figuring out what's going on, what's impacted, that sort of thing. The safety officer is also crucial because they're looking at the employees and looking at the safety of those employees and visitors, but also patients. The safety officer should be key to looking at if people are, again, going back to our discussion about EAP and people employees being impacted by disaster, that safety officer are people even doing things very simply, like, if there's a huge stress of a disaster, whether it's, COVID-19 pandemic, or whether it's, a hurricane or fire or flood or both, do you have your employees working super long hours and they're not taking care of themselves? Are they eating? Are they drinking? Are they going to the restroom? Those very simple things. Is their emotional health being met? Are they feeling survivor's guilt? So that safety officer is a role within your organization that really focuses on the safety of not just the building, but also safety of your staff, patients, and visitors. Your liaison officer role. We think that this is a crucial role. As I talked about the role of the CEO before, your liaison officer is the person that's going to liaison with maybe your county office of emergency management or public health or hospital, and maybe even with an outside agency, or maybe direct relief. Many of you know of direct relief, one of our favorite clients. So that liaison officer is crucial because they are outward looking, and the health center is going to have some resource requests. We know that swabs were a big issue, and obviously PPE during, in the beginning of the pandemic. I know there's been off and on. I heard swabs are still an issue for testing, etc. So that liaison officer works with the entire incident command team to say, what are our resource needs and where do I get it? And that liaison officer is that outward facing of, hey, emergency operations center, hey, public health, do you guys have any PPE for us? Or coordinating with your PCA or HCCN or whatever it may be, or even with NAC to say, I'm the liaison officer and we need resources. So that's a crucial role. And that's a perfect role for your CEO who's already kind of has those relationships externally with their partners, with your partners. So liaison officer, great idea and a great role for your CEO. So your operations section, and these are the doers. These are the people that are going to provide patient care. These are the, if you're doing triage, if you're doing whatever it is on the initial part of the disaster, but let's say that operation. So when Bart's talked about, they worked with their chief medical officer and worked with the coordinator of the volunteers so they could do the testing and the vaccinations. That is operations. So the doers of the group. Planning section is crucial because the planners are the ones that are figuring out the next 6 hours, the next 6 days, maybe the next 6 weeks or 6 months, depending on the type of event. That planning section figuring what our resource needs, what our staff needs, what our supply needs, what our technology needs are, and they work closely with the rest of the divisions and with the incident manager saying, how are we going to get the things that we need in order to be an effective responder, and more importantly, minimize those business interruptions, and so we can get back to the business of providing healthcare. So that planning section is crucial. The logistics section, these are the getters. These are the people, whether it's they're going to get pizzas and water for people, or they're getting the resources or communicating, hey, we're getting low on personal protection equipment, or we're getting low on swabs for testing. They communicate that to the liaison officer up the chain of command and say, hey, by the way, we need these resources, and work with the planning section to say, logistics said, okay, I'll go get those things. Planning's like, okay, well, we only have 3 more days of X. Logistics are the ones that are going to go get those things. But it's all working in concert for an effective response and recovery. And then lastly, the finance administration. And people want to think that they're not crucial, but they're absolutely crucial. For those folks, CFOs on the call, the folks that serve in finance, the ones that keep the bills running, that finance administration is crucial in disaster because oftentimes you have you have a lot of extra cost when you have a disaster, and it might be you need to buy you need to buy food and water for people because we're working longer hours and we're setting up our incident command, or we're, people can't go home because their homes are evacuated due to a wildfire and they have to figure out something, or there's extra costs like we have to buy a generator because there's a public safety power shut off and the fire, and our utilities shut up so so that happens. So that finance administration, if they're tracking the costs of that disaster, that can get, it means that those costs might be reimbursable by FEMA. When there's a presidentially declared disaster and there's federal resources that come to a state and come to a region after a disaster, there's a 75% share of costs. And so it's really crucial to track those costs. So that finance administration is absolutely vital. So that's important to know. And so that finance piece means that health centers have the resources we know. So again, whether it's tracking the cost of a generator or overtime, I know that's, something that we've seen, or that, now that CMS is covering the cost of telehealth, we know that then there were some technology costs that you had to underwrite. Some of that stuff might be reimbursable by FEMA or it might be reimbursable by HRSA. So that finance administration piece is really key. Okay, so this is a little bit scary. This is a really big disaster. This is a level 1, all hands on deck structure. and you, for your organization, go, I don't know if I need all this. This is a lot. So what I just want to share with you the difference between this slide and the difference between the previous slide. There we go. It's really the same slide. It just has a lot more position. That has a lot. Again, these are positions, not individuals. 3 people can have one of these positions, and then as it becomes more complex, you go, wow, we really need a lot more hands. We need a situation unit leader. We need, on the finance administration, we need someone to just do claims, compensation claims, and someone else to do costs, and someone to just track overtime or whatever those things are. For the most part, health centers aren't going to have this level of detail in your incident command structure, but it's good to know that you can do that. There are job action sheets that we can provide you. We didn't include it. We were trying to keep out, not to have the business continuity, because we didn't want the business continuity a template to have, too many pages, but there's actually job action sheets for a lot of these positions, and you can find them online as well that are clinic friendly. So just to think about. So, you may not be, for, incident, again, it's scalable, flexible, based on the needs of your disaster. So think about what you need in order to manage your event. And this is if you need to add more people or you need to handle more positions, it's a way to go about it. And maybe you're going to have just operations and just planning, and you don't need as much logistics. It kind of depends on the type of event and what you need to recover from. Okay, now we're going to go into succession. Oh, wait. Yep, that's right. We have a poll going in. Moving on to succession planning, and because we talked about that. Okay. And share the entire screen. Can I launch the poll from here? Here we go. Here is your question. Who will take the place of your incident commander if they become available? Who in your health center? Do you have an idea who that is? And you have the opportunity do we have support from, do you guys see the opportunity to how to respond to the poll? Folks?
So if Amanda could put the number in the chat so they can respond to the poll, that would be great. So attendees, have your phones ready, so when you get the code, you can go ahead and put in your response, or you can also use the chat function.
Yeah.
And Nora, while we're waiting for the response, I have a question.
Yes.
For long-term incidents like COVID or persistent threat like wildfire conditions, do you recommend rotating the person in the incident command role among 2 or 3 identified people to allow some personal downtime / recovery?
That's an excellent question. Excellent question. Yes. And that's why you want to have several people serve and pre-identified and have them trained on what they're supposed to be doing. Yes, you do want to change your incident commander. Does it mean that the event management changes? No. Again, if you have that structure and you have an incident action plan of what you're going to be doing in order to manage that event, you really shouldn't have really a big change. What you really want is, because that individual needs to go home and get some rest, and yes, and it's really tough with COVID, because it's such a long standing activation, which is not the norm. You're like, boy, I've never done this before, and boy, careful what you wish for. So, yeah, so you do want to, as best you can, what you do want to do is rotate and identify. And you might have initially had 3 people identified, but you might have additional folks that identified after. Like you might say, okay, now we have 5 or 7 or whatever that number is that can serve in that incident command role. And what's important to know about that is it's not just incident commander. So maybe you're also switching out the roles of public information officer or liaison officer. So again, there's job action sheets, which I talked about, and I'd be happy to send out to folks, and it's part of our toolkit as well. Those job action sheets are really important because it's like, I've never seen this before. Well, here's an idea of what a public information officer does, or what a incident commander does, or safety officer, and there's just some standard kind of roles and responsibilities, and you use it as a guide to guide your event. So it looks like, okay, so here we go. Things
We do have a couple of people that responded in the chat.
Okay, thank you for doing that, and thank you for bearing with us. We're doing okay for time, it looks like, correct?
Yes.
Okay, wonderful. All right. Not sure what's going on with this poll. I am so sorry. Thought it was all good.
So we do have some responses in the chat. One person says that it's a chief operating officer. One other person said probably the COO or the CEO. And this is definitely a best practice from Kathy. We go 3 deep and have people who have incident command ready for incident commander. So there are 3 people deep and trained in doing the incident commander position.
That's awesome. That's an excellent best practice. What I've also seen is I've gone into health centers. Mission Neighborhood Health Center is one of them in San Francisco, where you go in and on the board in the administration office, every day it tells you who's incident commander, who, and it doesn't matter. It's every single day. It's not just when there's a disaster. So phenomenal. Okay, we want to make sure we wrap up and have time for questions. Okay, going now into succession planning. So the situation we just discussed, so we have different roles for different organizations. And that's the other thing too, we know that some of your health centers have 50 employees and some have 1,500 employees and are large operations. So again, you want to have several people deep because you never quite know. So succession planning is preparing for an employee for new roles. That's just really key. Succession is a process for preparing those employees for those roles, and it could be in everyday operations or for crisis operations. We're going to talk just about crisis operations here. We're not going to talk on a daily basis. It could be defined as identifying and developing new leaders who can replace old leaders when they leave. Also retire and die, sorry to say. We've also seen succession planning. This is something that you can use in disasters, but also these are some tips. We know that health center leadership kind of turns over on a regular basis. So some tips that also maybe support. But again, more importantly, that keeps that leadership at a steady level. So should there be a disaster that causes a disruption, you have a good team, you have a great leadership team that can make and weather the storm and be resilient. Okay. Let's see. A succession plan also will have key roles identified because that's important as well as 3 individuals. As I said, we like to do that. And many organizations have those protocols that limit situations. There's no more than one or two key employees that can be unavailable at one time. So you can't send the entire senior leadership out for 2 weeks and then, you really want to kind of keep a few people on hand just in case something happens. Okay. All right. So moving on here. All right. Succession planning. Key successor should only be assigned to one primary or alternate position. And why this is that you don't say, oh, well, Jose or Mary or Joe or whoever can serve all those roles in incident command. Well, we know that everybody has their limits. So think about, again, all the 3 deep. Thank you very much for that health center phenomenal best practice. So you want to think about a couple of positions for these each individuals. And for succession planning associated with normal operations, a development plan can be used to groom and selected individuals for a future role. So we think that that's important as well, and thinking ahead as best you can. Individuals that are selected to serve as a successor should be selected based on their skills, core competencies, and backgrounds. And something to say about that is you're like, okay, well, I think that the CMO, Chief Medical Officer, or COO, your Chief Operation Officers, would be great to serve as an incident commander, or great to serve in this role during disaster. Well, what ends up happening sometimes is they're not really sure what they need to do. So that's why training and the focus on incident command training, letting them know, doing exercise to test their roles and get them to practice serving in those incident command roles ahead of disaster means, again, minimizes business interruptions. They're like, okay, I remember, I know what to do. Homework, talk to your health center leadership and find out more about how your health center's succession planning is going. So it's a question, how's it going? Is it something you're thinking about? We know that health center management are tireless and work amazingly, have amazing commitment to the community and to staff and to patients, but think about, you never quite know. So that's why succession planning is important. Okay, moving on. Okay, here's some steps. Want to give you some steps, not just say, hey, it's a good idea to do it. Want to give you some steps, and this is also there is some information about succession planning, and these steps are also in the template that we provided. So identify those key positions within your organization. Who really keeps your health center running? Who pays the electricity? That's important. Do they know how to pay the electricity? Who authorizes changes in policies and procedures? Maybe your chief human resources officer or chief operating officer. Who updates your software? Your chief, your CIO, your chief information officer. Those people are just really important to know who those key positions are. Identify those core competencies for each of those positions. That's important because you know what they do. And so not what so-and-so had that role 2 years ago, and that we have a new person and now they have these, this job and that job. So it's just good to know for your organization who has what. And so an org chart's a great do you have within your org chart what your key roles and responsibilities are. Thinking about job profiles and description of each of the positions roles. So again, incident commander, we talked about the job action sheets. We'll send that along as well. And we'll send that information. And do this just as you would if you're hiring someone new for the position, develop those job profiles. And what I also have seen in other health centers where they've actually said in the job description, this is your potential incident command role within the organization. So if we have to activate, so you already know this is your job description and you might serve in this role, and this role, if needed, because again, if there's a few roles you might serve in. So they already know going in that they have a role in disaster and it's already pre-identified for every single job description. That's another best practice. Implement recruiting initiatives. Again, let employees know you're recruiting individuals to serve as successor for that position. And why that's important is, again, collaboration and communication are really key. And again, this whole point of succession planning is minimize business interruptions, whether it's interruptions because a key employee left and you don't even have you don't even have their computer or whatever that may be. It's just important to know that. Number 5, developing the selected employee, perhaps shadow someone. Like if in terms of continuity, it's important if you have identified that only one person in your organization knows how to do something that's key to your organization, you want to make sure that you have 2 or 3 people identified to also do that thing. And is that key activity that that person does for your organization, whether it's pay your health benefits or whatever those key things that you've identified when you've gone through your business continuity plan, it's crucial that you have several people deep if in case that person leaves or unfortunately gets hurt by a bus or whatever that may be. Um, so can you do FEMA training or online training or local training? There's also oftentimes your local healthcare coalition does training on incident command, government training. And then appoint the successor for that position. It can be done the same way as you do the original employee, or you can, appoint someone that meets that criteria. One thing that we think is also important that we've seen as a best practice in succession planning steps is to ask people, kind of do like a resource mapping of your employees within your organization. Until you ask them, maybe they work for you now, but maybe they've been in the military. Maybe they're a janitor, but they are Red Cross volunteer or community emergency response team volunteer, or maybe they worked emergency operations center staff before their previous life as an emergency manager. So ask your employees just to, hey, by the way, who has this great skill? Or maybe they're a prepper, or maybe they watched too many too many episodes of prepper, or whatever their focus is. If they've got to focus on preparedness and they've got to focus on emergency management, you may want to support that effort if you can and put them as part of your team and add them to your team, because they might be really valuable to you, because like I've said, they might have been in the military or worked at a hospital or worked for public health and they've done an activation for emergency operations center. That might be really valuable. So think about that. Okay. All right. Now we're going to talk about during the incident. So during the incident, assist with the transition as the position is handed over. Again, we're not like, oh, you're now the CEO. No, you're going to serve in whatever role we've previously identified as you're going to be the incident commander. You're going to, and it's not whoever wears the vest. Whoever's wearing the yellow vest is automatically logistics. Could be. It could be, again, you want to give them support. They can be difficult when someone steps into the leadership, but supporting that successor during the disaster will benefit your health center, but your patients and also your community. So that's during the incident, and document the transition. So what we are we think is really important is what's called incident action planning. And incident action planning is when an event happens and you document who's in charge, what's the leadership structure, what are the issues, what are the health and safety issues, what are the operational issues, have I decided my building's damaged and we are going to move our operations, or we're going to use our mobile medical unit, or whatever it may be. It's just really important to identify and have everybody know what that plan is and document the transition. Okay, now here we have, for this operational period for the next week, this person's incident commander and this person has this role. And the next week you meet and go, okay, now we have Mary instead of Jose that's in charge of that. So, so during the incident is crucial. Document it, and it'll also help with the legal requirements when you're trying to write an after action report. It's really, that documentation is really key, because you can't remember. You're gonna, oh, I remember what I did 3 months ago, 3 months and 2 days ago. No, you don't remember what you ate for lunch last week. Okay, so write it down. Especially, it'll help you to evaluate, hey, we did this pretty well when we did our after action. Hey, we did this great. We did these 5 things that were great. And hey, this is a way for us to improve our operation. Okay. Post-event, it's really important. Post-event, it's really important to evaluate that effectiveness of that succession plan. And anytime you have an activation, you want to identify those changes that have to be made to your duties. Like, oh, well, we gave this person this role and maybe they weren't quite ready for it. So it's important. Okay, moving on to remote work. Okay, so we're more we're going to switch gears a bit. We're talking about continuity, discuss how to manage HR issues during the disruption, and talk about a popular topic in workplace today, managing remote or teleworking. Okay, so remote work and telecommuting are often used interchangeably, but there can be a small difference between the two. Um, Remote work suggests that an employee is just that, remotely located. It's not a technical definition. It does imply that the employee is far away from the company when it comes to the office. They might work remotely on a temporary basis while traveling, or they might be a permanent or remote worker. So telecommuting, also called telework, can mean the employee might be working on site some of the time, however, they might be coming into the office. So most positions consider telecommuting is usually filled by candidates that are geographically close to the business. Remote working telecommuting has been viewed as an opportunity for businesses to help reduce the impact the commuters have on the environment. The other thing too, because of COVID, we've seen it's a crucial step in reducing, obviously, the spread of COVID. And now that we have, not every position is eligible for remote work and telecommuting. We know patient care, obviously some of it can be done with with telehealth, but sometimes you have to physically see the patient. But we know that clinical staff are not able to do it if their skill sets are used in direct contact with patients. But we've seen a big rise of telehealth, and that's really been a big help in organizations. Okay, we have another poll, so bear with us on this tech issue if it doesn't want to cooperate. Okay, let's see. Whoops. All right. Whoops. So sorry, folks. There we go. No. All right. Here is the poll. Here's a good. The question is, I know I was able to get it to, no. Shoot. So sorry. Jervine, the question is, health centers have regulatory requirements that require business continuity planning. And the answers are yes, no, or not sure. So why people are answering that?
Yeah,
Okay.
and for folks on the line, Amanda put the link to the poll in the chat, so you can go ahead and click on that link and respond to the poll. And Nora,
Okay.
we do have a question while we're waiting for responses
Sure.
to come in.
Sure.
Well, more so a comment. Just a comment. For training, it is important to rotate exercises of the roles of identified successors so that they understand their roles and how it functions.
Absolutely. That's whoever added that. Thank you. That is really important because, and the point they're saying here is that you always, again, expect Jose to be the incident commander. An excellent tabletop exercise or discussion-based exercise is if you're expecting this one person that you count on to be the one to help you in a disaster, and again, that person is their wife's in labor, they're on their sabbatical, they're impacted by the disaster and they're not there, who else is going to step up? It gives that individuals the additional people that have been identified to serve in those roles to practice and go, oh, okay, I practiced and I wasn't crazy about what happened. I wasn't crazy about that. Okay, I need to go get more training on how to be an incident commander, or how to be logistics section chief, or whatever that may be. So very good comment. Thank you. So do we have some answers? Yeah.
75% in the poll saying yes, 25% are saying no. And then we do have some people responding in the chat, yes. So again,
Okay.
The question, did your health center create a remote or a telecommute policy in response to the COVID-19 pandemic?
Okay. And so most people have. That's great to hear. That's great to hear. Okay. All
And,
right.
and so, Nora, so as we are kind of transitioning back into, you know, life after the COVID,
Mm-hmm.
are you having any experience with some people that some employees are staying remote, but some employees have to come back in? And how do you communicate that to make sure everyone feels like they're treated fairly?
That's a tricky one. That's what HR specialists get their monies for.
Yeah.
They're worth their weight in money and gold at that point. Part of the problem is some positions can't be remote and some of them have been remote. I think that you just to try to be fair, um, it's a tough one. I think the issue is that some people it goes back to some people are great at their jobs working in a remote environment, but maybe the health center says we really need you back in the office, and for whatever reason, it's something that has to be worked out between your supervisor, yeah, you and your boss. But do the best you can, and if that doesn't work, try something different. Um, but yes, it's not a wow. We're just gonna it's all gonna be shiny happy people coming back because there's been a huge disruption and it really wasn't just to your job or it was to the entire world and it's still continuing and it impacted so many other things as part of your life that's not related to your job, such as how to take care of your kids and get remote learning and taking care of your family and taking care of your aging parents or whatever those things are. So, not to punt, but the issue is you have to do the best you can, and how to be fair. You're going to do the best that you can, and but some positions are probably better in the health center, and really, what this is an opportunity for you for senior leadership to evaluate what worked, do an after action report, and do an after action session with them with your staff and say this is what worked. This worked that we had, oh my God, we all these people that would never work remotely before, and we had no idea if it was going to work. And what do you know? It worked. It worked, or boy, it did not work. And these are the reasons why. And what's important is you take all of those lessons learned and put it back in your plans. Do you now have a remote from work policy? Do you have that? If not, now's the time to write it up and say, well, this worked under this condition, and maybe I need to make some changes here. Um, so, so step one on developing a remote work policy. Um,
And Linda just put a comment that the policy should also add requirements for returning to work, which cause them issues.
yes, yeah, that's certainly like what are all the operational issues? All the operational issues. Yeah, for absolutely. That's a very good point. Okay. So we're talking about remote work policy here on 24. Okay. So step one is developing that remote work policy. Um, should include specifics as communication requirements and managerial oversight. Sometimes that's, again, you do the best you can, and evaluation of the workers' performance. There are some people that are more efficient in an office or in the health center. They are, because they have too many distractions for other things. So it's, you know, be as patient as you can and do the best you can. Okay. All right. Developing a remote from work policy, you want to say why are you creating that, and then what issues would remote policy solve? Um, developing those procedures, how often should the staff check in with their supervisor? How do you conduct virtual meetings? I know there's a lot of Zoom fatigue out there. We've heard that, and here we are doing a webinar on WebEx. But are those ways that you can better engage the staff, even just phone calls? It's like, oh, good, I don't have my lipstick on. This is a good thing. Are there limitations on the remote work policy? Like limitations on, well, it can only be for a certain amount of hours or so many days, or only 2 days a week instead of 5 days a week, or whatever those things are. And which positions are eligible? Obviously janitors can't be, remote work doesn't work for them. So thinking about the eligibility issues. Equipment, what is necessary. What we've seen a lot of people do, a lot of organizations do, is to create a whole, like, basically internet and computer in a box and say, here, this is it. What maintenance requirements for equipment and, you know, internet access. Are you providing hotspots for people? Are you providing phones with a hotspot, or what are those things are? Security is an issue too remotely that you have to deal with. Um, Time worked, are people working 9, 15 hours a day, whatever? It's just important. Do you have an opportunity for, on your time worked, can you work 4 hours in the morning, do remote learning with your kids, and do 4 hours in the afternoon, or however that works? Do you have a cybersecurity plan? And we did talk about that in the previous sessions. And then, do you have an agreement that people can sign? We think that that's also important. Um, having an agreement of, this is, I'll do these things, and if this is not working, then again, that's worked out between the supervisor and the employee. Okay, we're wrapping up near here. We've got just a few more slides we wanted to share. Talk about the state and federal regulations related to remote work and how they impact business continuity. So federal legislation acts as an umbrella laws for state implementation. Example, a minimum wage requirement for a specific state enacted, shops and establishment acts must be in line with the minimum wage act. So you can't have, they've got to be in line with federal level. And then state legislation addresses the number of legal concerns in the workplace. It could be standard labor disputes, contractual relations, even discrimination and sexual harassment, those kinds of things. So those are some labor laws specific to HR and continuity. Okay, here's just a few of the labor laws that actually impact, that are part of HR, that are specific to, that could make a difference. For example, Occupational Health and Safety Act. If, for example, an employer does not do anything about an unsafe workplace around, if there's been a workplace violence event, OSHA, or Occupational Safety and Health Act, can come in and provide, safety violations, state and federal, for that workplace, wage and hour laws, that sort of thing. We do not want our employees working 20 hours a day. That's not, helpful. Affordable Care Act, Americans with Disabilities Act, all those kinds of things that impact, that you have to consider when in a disaster. You really want to, do the best you can and be, get as efficient as possible in order to get back to operations, but you still have federal employment and labor laws that oversee all of those things. Okay, wrapping up here. Also, federal employment, labor laws, state employment laws and labor laws include, they talk about child labor laws, minimum wage, minimum meal periods, paydays, workers' compensation, etc., and then right to work. So those are some things to think about. Again, and when you don't want your employees working too long during disaster, but just something to consider. Okay, so this is the resource that we've been talking about, creating a business continuity plan for your health center. Thank you very much. Huge shout out to the NAC staff that made all of our PDFs fillable, so it makes it easier for you to create your plan. And we're in terms of resources, so that's where how to access that. And I know by attending all 3 of our sessions, you get our Business Continuity Institute certificate. And we're at the questions.
Okay, thanks so much, Nora. Oh, so we have a question. Is there an example of the policy in the manual? And I think they're referring to the remote or telecommuting policy.
I think we have some links to, I believe there's there are some resources, and if I'm completely wrong, but again, we wrote it a bit ago, so, but I believe that there are, yes. And if not, if you don't have what you're looking, if we did not include what you're looking for, please send us an email. We'll be happy to share it. We'll be happy to share it with Mac staff. They can get it out to everybody.
Okay, question. For wraparound services, what's the best way to communicate the behavioral health to employees to remove any kind of stigma?
That's a really good point. I think you want to make a general announcement, number one. And if individuals, I think that's where supervisors with their direct reports are great at communicating. The stigma, it stinks that 2021, there's still a stupid mental health stigma that should not be there, but that's a whole nother webinar.
Totally agree.
But the issue is that I think that's where the direct reports and the supervisors really need to, if they're really struggling, and maybe the individual that's struggling doesn't understand that that's related to the disaster, which is certainly possible. And the disaster can be at the workplace, just so you know, your EAP program is not just there's been a disaster at your workplace. It could be they are a victim of disaster, they're a victim of domestic violence, and they have no idea what to do, and they're lost, and they're just trying to get through the day kind of thing. So that direct report supervisor relationship is really important, and it doesn't mean that they're weak, or obviously we know. It's an opportunity to say, hey, just so you know that this is a resource. It's just information sharing, and hey, we care. And it's not because we care because we want you to show up and do your job, but no, we care because we want you to know that you're not alone, and we're here to support you. But great question.
Thank you so much for that. And this isn't on with telework or remote, but I'm thinking about telehealth, and once the public health emergency is taken away, all the things that they relaxed are going to be changed so far as make sure that HIPAA compliant, where the provider has to be and where the patient has to be. So that's something to start thinking about now. It's like, what are we going to have to change in order to make sure that those telehealth services are going to be appropriately delivered after the public health emergency ends?
Right. I think that that's really important because, and we hope that, if anything, we've had a long time now, a year plus, of extensive use of telehealth, that we sincerely hope that HRSA and CMS support the extended use of telehealth from this point on, and not have it to be a disaster, because it's been such a wide success. And other providers that I've talked to, they're like, we're not going back unless we absolutely have to. But even Kaiser, call of mine, said 80% of our 80% from this point forward, we've already determined, are going to be telehealth. We think that we've such a, because it was forced on them, no offense, and until we also saw health centers that talked about doing telehealth for like 7 years. It was approved by CMS, and they within 24 hours turned it around and started activating telehealth. So that's kind of what it takes, but that we don't know if it's actually going to go back to the old way. We certainly hope not, because it's been a unmitigated success in my view. And hopefully, again, that's another, clinical affairs can obviously hopefully work with HRSA and CMS to extend the use of that, because I think it's been a big success. If anything, that's, for the wrong reasons, but a big success.
Well, thanks so much, Nora. We're not having any more questions coming in, but I'd like to thank Nora and Amanda with Connect Consulting for helping us with this series. And also I'd like to thank the NAC staff, Ellen, Liz, and Alyssa, and Olivia, who helped launch this program. And thanks to all you attendees for taking time out of your busy day to learn with us. And with that, we're done for this afternoon. Thank you so much.
Thank you so much for having us. It been an absolute pleasure. And if you have any further questions, please reach out to us, and we'll be happy to share with NAC the kind of questions that we get, and our goal is to support the resiliency of health centers as best we can. Thank you. Thanks so much for having us.